Hello, I'm Holly Tanner with the Herman and Wallace Pelvic Rehab Institute, and I'm here today with Aparna and Leanne, who are going to tell us all about their course on breathing. And so, Leanne, would you introduce yourself and a little bit about your background?
So my name is Leanne Taptich. I'm a physical therapist for 15 plus years now, I think. I have my manual therapy certification through the University of St. Augustine. I'm a board certified sports physical therapist through the APTA, and I also hold a strength and conditioning certification. My primary practice is outpatient with ortho and sports at this time.
Hmm. And Aparna?
Hi, I'm Aparna Rajgopal. We and I work together at a hospital in Southeast Michigan. I've been a therapist for I think, over 20 years. Started out doing orthopedics mainly and then switched to pelvic care about 16, 17 years ago. I have my board certification in women's health. I have my PRPC certification. I'm also CAP OB certified, so that's like pregnancy postpartum certified with the APTA. And actually, I started doing pelvic care because of pregnant patients that a lot of people didn't want to see. They were scared of seeing them. I ended up seeing them, and that's how I started to kind of like come towards pelvic care.
And Aparna, this course on breathing and the diaphragm, what was the genesis? What was your reason for being so passionate about this and wanting to get this going?
So it's got to be about 10 odd years ago that the clinic had a patient. She had paraesophageal hernia, which was surgically repaired. And she was sent to therapy because of just general debility and weakness, and she couldn't do stuff like garden or walk long. And she was in her mid-60s. And she ended up seeing two or three therapists, and they kept passing her on because she got better, but she had the same complaint that she couldn't breathe. And every time she said she couldn't breathe, the therapist would refer her back to the doctor. The doctor would run cardiac tests and would do all kinds of other tests and would say cleared and send her back for debility. So, in the process of passing the patient along, she came to me. And one of the first things she said was she didn't say she couldn't breathe. She said she had difficulty taking a breath of air. And she said she felt like she couldn't expand. So from that complaint, I kind of started assessing. And most people at that time, this is, as I said, a decade ago, weren't really looking at the thoracic spine a whole lot. So I started looking at the thoracic spine and I kind of realized that what she said was true. She couldn't expand from the rib cage at all. And we also know that paraesophageal hernias are kind of associated to increased intra-abdominal pressure. They're related to things like constipation, chronic severe constipation, chronic cough, those kind of things. So the process of treating her is how my interest in this developed. She got better. She got really, really, she healed. She did well. She did great. And I realized that this is something we can actually focus on and patients need it.
That's wonderful. And Leanne, was it similar for you? It was patient experiences that got you passionate about this topic?
So it's actually different. I started with Henry Ford, where we're currently working together about 6, 7 years ago. And Aparna did a 1 hour lecture on dysfunctional breathing, on just breathing to help us understand the mechanics with the pelvic floor and the abdominals. And then it was a light bulb moment for me because I've always looked for what my missing link was with specifically lumbar patients and low back pain patients. This makes sense to me. What I used to do is all the transverse abdominis engagement doesn't really work for all patients or everyone. And this is kind of what I still call as Aparna is my missing link. So it started off with that. And then we collaborated and did a 4 hour course that ended up having 8 hours of content because we couldn't stop talking and research about it. And then it just fruitioned into what we have now of the full weekend course. So it's a great mashup of ortho and pelvic floor for both of us. It really has helped both of us treat our patients better from a pelvic standpoint and orthopedic standpoint for low back pain. It's just worked so well for us the past few years since we've started collaborating together.
And I think part of it is because we work together that we really are able to pass on three patients jointly together and incorporate both. She's a sports trained, she's an ortho manual trained therapist, and I've got the pelvic floor aspect of things that I bring in. and the diaphragm aspect and the breathing. So we kind of tie everything together and we treat our patients in a very holistic way.
Hmm. And so I imagine you had mentioned there's some anatomy, and I suspect some physiology and, discussion about different pathological aspects of what we do. What are some of the lab activities and skills that participants can expect to walk away from this course with?
A ton.
Mhm.
So we have manual therapy from joint lobes to myofascial releases. We go through an exercise progression. We also have a lab on posture. We have a lab on different breathing techniques and what to look for and how to fix once you find what you're looking for, different assessments. So we have a lot of videos that are incorporated in our weekend lecture to help us segue and supplement the hands-on learning with the virtual aspect of things.
And we try to progress. So we start with like assessing what you'd assess for, what you think is the stuff you want to address. And from that point on, we go to the treatment aspect, which is where we, as Leanne says, we peel off the layers. So it starts with the fascia and then moves on to the joints. And then from there, and we kind of ensure that there are a couple of things we're addressing. One is that we get this question quite a bit. So we address breath in terms of both a pattern and in terms of from an orthopedic perspective. So the class goes through and kind of talks about both, and the labs address both those components as well. And the exercise component specifically, because we find a lot of participants come with the perspective or the idea that in every exercise should be accompanied by a very hearty, hard exhale. Throughout the course, we try to remind people that that's not the end goal of a course. It's a lot more than just how to breathe with an exercise.
Hmm. And what kind of feedback have you had from folks after taking the class?
So we get told very often that this is the best class in Herman and Wallace, which is a huge compliment, even if it comes from just one person, because of the combination perspective that we bring. And we have a lot of orthopedic therapists take the class, and we also have a lot of pelvic therapists take the class. We've had some speech therapists, OTs, we've had yoga instructors. We've actually had like overseas physicians, gastroenterologists take our class. So we've had a lot of people, and they've been very complimentary about the fact that we don't just address it from a breath perspective. We do talk about the abdominals, we talk about the thoracic spine, we talk about the pelvic muscles, we talk about fascia, we talk about intra-abdominal pressure management. So we get a lot of compliments about how much we cover in the course, and also that we bring a fairly unique perspective to it.
Well, Leanne, is there anything else you want folks to know about the course?
So my big thing is we try to incorporate more of the regional interdependence models because they come in with pelvic pain or low back pain, that looking more above and below and beyond that to see how the system is functioning together. And we like to see how the body moves as a whole than just focusing on one part of it. And that's where most of our treatment is derived from and how we work together on that.
Well, thank you so much for taking the time to tell us about your course. Sounds like folks have really enjoyed it. So
Thank you, Holly.
Thank
you're
you.